Hello, my name is Catherine West, and I'm an infection control consultant, and I've been working with fire EMS agencies for, let's just say, many, many years. I wanted to take this opportunity to talk with you about the upcoming flu vaccine season and its importance in the time of COVID-19. So flu vaccine has an increased importance for this upcoming flu season because of COVID-19. Now, a flu shot will not protect you from acquiring COVID-19, but we certainly would be ahead of the game to be protected so that we might not become co-infected. And yes, co-infection has been documented. So let's take a look at some of the statistics that the CDC put together on estimates of seasonal flu from October 1st of 2019 to April 4th of 2020. They estimated 39 to 56 million illnesses related to flu. 410,000 to 740,000 cases would result in a hospital stay. 18 to 26 million medical visits for flu. And that there might be 24,000 to 62,000 deaths related to seasonal flu. And of this, we have documentation that 188 were children. So looking at avoiding the risk, what can we do to avoid the risk of seasonal flu combined with COVID-19? And how could we assess patients for whether or not they might have normal seasonal flu or COVID-19? When we look at the signs and symptoms for COVID-19 as compared to seasonal flu, you will see that they are virtually identical, except for the loss of sense of smell or taste. So asking signs and symptoms and documenting them is going to be a very important part of patient evaluation. When comparing the incubation periods, COVID-19 and seasonal flu, once again, are very, very similar. COVID-19 within 5 days of an exposure event, seasonal flu, a shorter time frame of within 1 to 4 days of an exposure event. So let's lead into prevention for seasonal flu, for the upcoming flu season. And we have options which a lot of people are not very well aware of. We have various options to choose from with regard to preventative vaccines for seasonal flu. Now, if you were to go virtually anywhere and ask for a flu shot, just a flu shot, this is what you will receive. Normal trivalent, meaning protection against 3 strains of influenza virus that have been projected, and this is a combined effort between the World Health Organization and the CDC, to determine which strains will be predominant for the upcoming flu season. Now, you will notice the names: Hawaii, Hong Kong, Washington. Well, these are different from the names last year and the year before. Why does this change? Well, we know that influenza viruses change. This is called angenetic drift. These are small changes or mutations in the genes of the influenza virus, and this can lead to changes in the surface proteins of the virus. And wherever this change is noted, they get the name. So the first type A virus which is an affiliate of H1N1, was noted in Hawaii. The second type A, Hong Kong, and the type B, Washington. Now we have another choice as well. We have quadrivalent vaccine, which protects against 4 strains of influenza virus, 2 type A and 2 type B. So you will see that the 2 type A and the type B Washington are the same as in the trivalent, but added is Phuket. Phuket was also the second type B virus that was in last year's vaccine. Note that flu mist is back once again. The nasal spray is ideal for individuals who don't like shots, but would like still to be protected. So it is once again an option. Now, what about persons who have allergies to mercury or antibiotics or eggs or egg substances? Well, there is a vaccine that they can safely take. Flucelvax is readily available. The next vaccine is specific to seniors, persons 65 and older. It is called Fluzone. It is also quadrivalent, and that's important because individuals who are 65 and older, if they take the normal trivalent vaccine, that only gives them about a 60% protection level for seasonal flu virus. This one gives a 4 times higher antigen protection. In 2013, one of the newer vaccines first became available, and it's a cell-based vaccine. The most common name is Flublok. It contains no virus, living or dead, no eggs, no antibiotics, no mercury. There's not even any latex in the top of the medication vial. It gives a 3 times higher level of protection and is approved for individuals 18 and older. This new form of vaccine production is using DNA technology. With this, we have not seen any risk for complications, such as Guillain-Barré. So employees who have allergies, there are vaccines that they can safely take. Flucelvax or Flublok. If an employee has allergies but would like to participate in the flu vaccine program, then the employer is obligated to make an appropriate vaccine available for that individual. Now, a lot of people we hear every single year say, I'm not getting the flu shot. Every time I take a flu shot, I get the flu. Well, this is the answer from CDC to that statement. Yes, many people report illness after receiving a flu vaccine, but it's not the flu. It's the vaccine working in your body to produce immunity. You can't get the flu from a flu shot. Now, in preparation for seasonal flu vaccine, I strongly recommend that you go to cdc.gov, click on diseases and conditions, and scroll down to influenza. There you will see handouts on frequently asked questions and answers. This one is there. And great fact sheets to hand out and as education and training before your seasonal flu vaccine program starts. And remember, you are in a priority group for vaccine. And all healthcare workers, which you're clearly in that group, named specifically by CDC and OSHA, you are to begin seasonal flu vaccine in mid-September. The CDC wants all healthcare personnel to have received their vaccine before October 1st. Where might these vaccines be available in your area? If you go to this website, flushot.healthmap.org, it will bring up Vaccine Finder. And this will give you a listing of where all vaccines, not just flu vaccine, but all vaccines are available in your local area. Many of them list the cost, so we can do some cost comparisons along the way. And a very unique element has been added this year. You will see a button that says, if you need a ride to get a flu shot, click here and Uber will pick you up. It doesn't say whether the ride is free, but it is available, and that can be helpful to a lot of individuals. So take a look at this. Now, in older times, many of us were familiar with the phrase, let your fingers do the walking. And we use the yellow pages to get information. Well, now we can let our fingers do the walking on our cell phone. Now, what about the use of personal protective equipment for the flu? It has always been considered and remains a droplet-transmitted disease. Droplet diseases have a 3-foot rule that generally, when expelled, they can travel 3 feet, they drop to the ground, and they do not come back up. For protection, we want to put first a surgical mask on the patient. Source control. It has always been a basic part of infection control to contain secretions at the source. Now, if the patient is coughing, not able to wear a surgical mask, then you can wear a surgical mask. You don't both need to wear a mask. Now, this is for seasonal flu. So in 2009, a big change occurred in healthcare. The term hospital-acquired infections changed to healthcare-associated infections, a much broader term encompassing more healthcare disciplines, including fire EMS. So what does this mean? This means that if a patient comes down with an infection 2 days after admission, and it is unrelated to their admitting diagnosis, the hospital will not receive reimbursement from the Centers for Medicare and Medicaid Services for the treatment of that infection. This is one reason why flu vaccine has been mandated for healthcare personnel. But it's also deemed by the Joint Commission to be a patient safety issue. Many EMS systems and fire departments across the country have already mandated flu vaccine as well as other vaccines to be part of the healthcare team. Now, what about flu vaccine participation in EMS? Well, there were 3 studies conducted across all healthcare disciplines. And in all 3 studies, the lowest participation group was EMS. We're first on the scene caring for sick individuals. And we need to do whatever we can to not add to the medical issues that they are already presenting with. So what is the flu vaccine participation rate in your department? And I think that that is something that should be included in annual update training on an annual basis so that members of the department can clearly see how they are shaping up as opposed to other healthcare worker disciplines. We need to remember that we are all members of the healthcare team and that we have a duty not only to protect ourselves, but to protect coworkers and to protect the patients that we serve in our community. So I hope that in going through this presentation, you will be more aware of things, vaccines that are available in your area. And I think that looking at your participation rate, you might want to consider picking a vaccine that you believe more people in your department would be willing to take and boost that participation rate. Give that some thought because we have many options out there and available to us. So this program was designed to get the word out so that you have an awareness of what is available. And remember, by mid-September, we want to begin our flu vaccine programs. So with that, I will close this session. Take care, work safe. Bye-bye.